Each year in the U.S., nearly 16,000 children between the ages of birth and 19 will be diagnosed with some type of cancer.
Joining us this morning from Gundersen Health System is pediatric oncologist Dr. Jennifer Orozco. Dr. Orozco, good morning.
Good morning. Thank you.
So approximately 1 in 285 children in the U.S. will be diagnosed with cancer before their 20th birthday. Now that seems high. Is that an accurate representation?
It is an accurate representation. The incidence in pediatric cancer has increased slightly over the last 10 to 20 years. Now, that isn't necessarily an increase in cases and worsening outcome for children, but actually we're probably getting better at detecting those pediatric cancers. So I think the main take home from that is it is significant, but luckily pediatric cancer is still very rare.
And what are some of the most commonly diagnosed childhood cancers?
Yeah, so the most common pediatric cancer is a cancer called acute lymphoblastic leukemia, or ALL. It is a form of leukemia that makes up about 30% of pediatric cancer. So it's really one of the major ones that we see here and across the country and world. The next most common cancers are a group of cancers, brain tumors, and those are going to be by far the two most common groups of cancers that we see in pediatrics.
Well, the word cancer is not something people want to hear, but are there ways that treatment is getting better?
Definitely. With pediatric oncology and pediatric cancer, we're fortunate as a country and really as an international group to be collaborative with the Children's Oncology Group. And that's a collaborative that has improved treatment and outcomes in pediatric cancer over the last 50 plus years. So back in the 1950s when we looked at pediatric cancer and the outcomes and cure rates, it was dismal, it was terrible. And when we look at it today, it's much improved. We're looking at chances of cure in the 80% plus. So treatment is really, there's great treatments that have advanced through this Children's Oncology Group. And it's really important because most pediatric centers, including some locally here at Gundersen, are part of that Children's Oncology Group. And so those treatments can continue to advance and cure rates can continue to improve.
Well, Dr. Orozco, thank you so much for your time this morning, and we really appreciate you joining us.
Yeah, absolutely. Thank you.